two really important breast surgery concepts I want to discuss, and that is how can we augment the breast with different techniques, and what is an internal bra? Because those words are thrown around loosely and nobody really understands what they mean. So what exactly is an internal bra? Well, that can mean a lot of stuff. That can refer to a suturing technique, or it can refer to the use of mesh, all designed to prevent an implant from bottoming out at the bottom of the breast. Despite our best techniques with suturing or using mesh, those things can still occur because we're really just trying to get your skin to adhere to the base of the breast, okay? So for different people, it can mean different things, all right? Not everybody needs mesh. Sometimes we need to add mesh later. Adding mesh ahead of time, even in people who might need it, isn't always super beneficial because it can lead to other problems. On the other hand, what is a dermal bra? What is an auto augmentation? There's only one thing to remember when it comes to breast lifts and breast augmentation, all right? If you want to meaningfully change the shape of the breast, it will require an implant. A breast lift is really a breast reduction. It's just a smaller reduction than what you may think of as a normal breast reduction. We have to remove the bottom part of the breast. If we try to remove the bottom part of the breast and then try to use it to augment the top half of the breast, it never works. Why? Because it's still starting from the bottom of the breast, okay? We're not transplanting it from the bottom to the top. Therefore, the tissue is going to end up back in the bottom. So the results may look good on the table, but they're not going to be that same result months later. And in fact, they will be worse than if you removed it. So again, we really want to remove off the bottom and then add to the top. All of the modern concepts in breast surgery involve saving the upper half of the breast and removing the bottom. That is the key. If we're adding an implant, we don't want tissue hanging off the bottom. So we want to eliminate that. That's why you see a lot of breast reductions with augmentation, because that tissue is no longer useful or helpful, and it really only creates problems. Auto augmentation does not work and should never be recommended in any form, okay? So that means also that if you're wanting a fat transfer to your breast, realize that it's not the same outcome as a breast implant. A breast implant is going to reliably change the shape of your breast and retain a certain volume. Fat will not. Fat will not change the shape of your breast. It will simply augment your existing shape a little bit larger without changing the upper half of the breast. And there are nuisances that can come with it, like fat necrosis or hard spots or oil cysts or mammographic change. There are certain patients that can do well with it as long as they understand the reasonable expectations and that it's not an implant. But the gold standard is augmentation with silicone implants, highly cohesive, that retain their shape and maintain fullness in the upper half of the breast. If you have any laxity of your skin or nipple malposition, you need a breast lift or reduction so that everything is in harmony, so that the implant sits on your chest and the breast covers the implant and is centered on there long term. Keep those things in mind and you will have a long-term result that does great without lots of needs for revision surgery.